We absolutely know from our everyday experience and contact with doctors in the system that they are working in systems that are increasingly under pressure, and that's true right across the UK.
We're working with employers and with organisations across the healthcare system to make sure that doctors are able to raise concerns, but also that those concerns are acted on, and that feedback reaches the doctor who's raised the concern so they can have confidence that their issues have been addressed.
We now have a very strong team of colleagues across the UK who work directly with doctors, over 40,000 doctors a year.
Sometimes while we're out and about, doctors will raise concerns directly with us, and it's then for us to decide how we're going to make sure that those concerns are addressed. That might be through us liaising with their employing organisation. It might also mean that we need to talk to another regulator such as the CQC to make sure that those concerns are addressed and that actually the environment in which the doctor's working and that patients are being treated is as safe as it can be.
We also have our confidential helpline, which hundreds of doctors have used since its inception to raise concerns with us.
We have issued guidance to doctors on raising and acting on concerns, and the ethical guidance has been out there in published format for several years now. We want to help doctors feel that they're able to raise concerns in a timely fashion if they're worried that something is unsafe where they're working, either for patients, for themselves or for their colleagues. And so we help them to understand how to apply our guidance and work through the steps in raising a concern to make sure that those concerns are dealt with as quickly as possible. The National Training Survey runs each year, and all trainee doctors are encouraged to fill out the survey and send their thoughts through to us about the training environment in which they're working. Doctors can use that survey to report patient safety concerns to us, and we will investigate those concerns.
We have committed to working with partners, particularly the BMA across the UK, Academies of Medical Royal Colleges, NHS Improvement and a number of system suppliers here in England to create a uniform, consistent and impactful system for doctors in training to record where they have been asked or are working outside their roted hours. What doctors have asked us for is, they've asked us to support them in developing their own capability and skill set around what we're calling challenging unprofessional behaviours. A sense that they can speak up to challenge what they see as behaviours which are harmful either to them and potentially by extension harmful for patients. We've done some really exciting work with thanks to our partners at the Royal College of Physicians here in London, which we are now extending, working with partners from the Royal College of Surgeons in Edinburgh, the Academy of Medical Royal Colleges, the National Freedom to Speak Up Guardian's Office here in England, and the Royal College of Obs and Gynae, to roll out that training programme